Welcome to the HQI Kickoff Stopping Sepsis in Virginia Hospitals and Nursing Homes conference call. My name is Allie, and I will be your operator for today's call. At this time, all participants are in listen-only mode. Later, we will conduct a question-and-answer session. Please note that this conference is being recorded. I will now turn the call over to Deb Smith. Deb, you may begin.
Thank you, Allie. And good morning, everyone. Thank you for joining VHHA and HQI to stop sepsis in Virginia hospitals and nursing homes. For the next hour, we'll be providing an overview of this special innovation project for sepsis, introducing you to our teams and your peers who have joined this important improvement project with you. We'll review the timeline for the project and give you a peek at the tools and resources that will be available to you through the project. We will make sure that we leave plenty of time for your questions and comments at the end, but during the webinar, please use the chat box at any time, since we do have Candy Hamner here to address questions and comments in the chat box. Next slide. So these happy, smiling faces are the faces of your team at HQI and VHHA. So I am Deb Smith, and I'll be working directly with the nursing homes in Virginia. Candy Hamner is my counterpart in Maryland, and she's actually been leading a project for the last year with nursing homes in Maryland. So she's our subject matter expert for this work and has the experience needed to identify successes and barriers to successes in reducing sepsis mortality and admissions. And then we also have our partners, VHHA, so Betsy Cole and Wanda Clevenger from the VHHA will be working directly with the acute care hospitals in Virginia. Next slide. So just a little background on HQI, formerly VHQC. We're a private not-for-profit consulting company, and we've served as the QIO for the state of Virginia for over 30 years. In 2014, CMS restructured the QIO program with some regionalization, and then that included Maryland for us. Our consultants come from a wide range of healthcare backgrounds. Our experienced team includes former hospital executives, nursing home administrators, nurses, physician practices, physicians, pharmacists. We're well equipped to handle your needs. Next slide, please. And we're partnering with this work with VHHA, the Virginia Hospital and Healthcare Association, which is an alliance of 107 hospitals and 30 health delivery systems developing and advocating for sound healthcare practices and policies in the Commonwealth of Virginia. VHHA also has a Center for Healthcare Excellence that's chartered around the vision of Virginia healthcare system that develops top-tier quality at the lowest cost. Our hospital representatives can contact Wanda Clevenger for any questions about that, because many of the people that have signed on to this as a acute care hospital to this work have worked with VHHA over the years. As a nursing home signing on to this project, you've also got the opportunity to join HQI as the Nursing Home Improvement Network. And this is the team that's working with you in the Nursing Home Improvement Network. So if you're not already a member, please find out how you can join this team also. Next slide. I just want to go over a couple things about the Nursing Home Improvement Network, where this project falls underneath. Some of the other work that they do is decreasing unnecessary antipsychotic medication, improving quality measures and your star ratings in the nursing homes, decreasing potential avoidable hospitalizations and rehospitalizations. There's a project to reduce C. diff and implement antibiotic stewardship. And then this special innovation project, Stopping Sepsis in Virginia hospitals and nursing homes. I also just want to mention how integrated this work is and aligning with other stakeholders and projects. It doesn't just align with HQI and VHHA projects, but also with all these other quality initiatives, including your own facilities' organizational goals. We want to work together to avoid duplication and create synergy. So you may be working with some of these other stakeholders on this slide, and just keep in mind that we will be working with them also to make sure that this work isn't duplicative. So why should we focus on sepsis? Now, as you can see from this graph, which we've used in other presentations, 1 million patients are diagnosed with sepsis each year. And of those patients diagnosed, 50% or 500,000 of them will die. Sepsis is the leading cause of hospital admission from a nursing home. These are staggering statistics. One of the best aspects of this special innovation project is the opportunity for hospitals and nursing homes to come together and work to identify, treat, and reduce complications and deaths from sepsis. So on the next slide, we'd like to play a video to support this important work and keep us on target for why we all fight so hard to do the right thing every time for every patient.
My mother, a 20-year breast cancer survivor, she died of unconceived pneumonia she never heard of. Shock, sepsis, she was like, how do you spell it? I don't know. Really does not affect that many people. Then why have charity? She got through that surgery, but she started complaining of a lot of weakness and catch up with. I should have worked that. I didn't understand it. I remember that I went to bed, woke up to find these EMTs in my room. My Dr. Fred called the hospital and said, look, unless somebody is coding, there's no one in there as sick as this man is right now. Get a doctor in there. In the next few hours, one shut down after another. All of my organs, lungs, kidneys, and eventually a heart attack. My toes were black and dangerous. It was very unclear as to whether I would survive. It was Halloween. He was up crying. I took his temperature, 102.3. His color was gray. His lips, everything was gray, and he was not responding. We got to the hospital. He got swelled up. He was huge. And one of the doctors said, we don't know if you'll be able to take him home. I've been waiting for him for all these months, and I've only had him 3 weeks. Right? I wish somebody had asked more. But I felt like I was supposed to know as a mother. I didn't understand that any infection could result in a toxic response that is from sepsis. It started when I went to the dentist. I had some dental work. Following that, I developed an infection. And then septic shock. I can't even describe to you the horror of being diagnosed. The body swelling up twice the size, fingers turning black, having to be intubated. It looked like someone took a shotgun and shot her in the leg. That's what it looked like. For me, this could have a very different ending. And that's why I share my survivor story. It was hard. Starting with the dad. Are you ready to hold him? Oh my God, yes. She put him in my arms. He's going to be okay. I'll give you a high share my story. Somebody will want to listen to it. But maybe somebody else can be saved.
Well, thank you for watching that video with us. I hope that everybody appreciated it as much as I did when I first saw it. It still kind of chokes me up. I just was so excited that there was a happy ending for the baby in that story, but, you know, very disappointed at what happened with the gentleman's mother. So this is why we're doing it, and I know we all know that, but I think every once in a while we have to take just a little bit of time and, you know, bring ourselves back to that. So, moving on, a lot of HQI's work is done through communities. So we have 7 care transition communities in Virginia. Some of them have been in place and been active for many years, and some are just starting up. So this data on this slide is from that project, and it shows statewide discharge data for the top 10 discharge diagnoses that lead to a 30 days. So this is data that's current to the first quarter of 2016. As you can see, sepsis is number 1. But not just number 1, it's almost double the second diagnosis of COPD, and ahead of heart failure, UTIs, and pneumonia. But even more staggering, when we look at the Virginia data this way, keeping in mind that these are our patients, families, and neighbors living in Virginia, in 2015, there were over 3,400 nursing home residents admitted from the nursing home to the acute care hospital with a diagnosis of sepsis on admission. Of those 3,400 patients, 780 will die while in the hospital, and another 683 will die within 30 days of discharge, which, if you do that math, computes to 1,436 Virginia residents who die from sepsis in 2015. That is actually even more critical, is that's 1 out of every 2 to 3 nursing home admissions for sepsis die in the hospital or within 30 days. So I'm going to turn this over to my cohort, my partner in crime, I guess, Wanda Clevenger, who is the consultant who'll be working with the hospitals in this project, and she's with VHHA. So Wanda, take it away.
Great. Thank you, Deb. Thank you. I've included this slide in the presentation just to bring this issue to mind that while payment is not a focus of the project, in addition to improvements in patient care and integration of care across service settings, alternative payment models are in our future. And bundled payments across care settings is one of those new payment initiatives. And so for more that providers can understand services that are provided in each setting and also identify gaps in care and work to improve that, I think that we will be ahead of the curve. So we're beginning this work together, and this quote from Henry Ford makes me reflect on this project, because coming together is the beginning, which we're doing now. Keeping together is progress, and working together is success, and that's our overall goal for this work. So just an overview of our project. So this is a special innovation project funded by the Centers for Medicare and Medicaid Services. As Deb said, it's a partnership between the hospitals and the nursing homes, which again is unique. And I think it provides us with great opportunities for supporting both care settings, identifying areas where we can see improvement, where there's gaps in care, and also having a parallel process go on in terms of work needed to improve sepsis care or identification in each setting, but also doing cross-setting work. It's a 2-year program, and we're looking forward to lots of collaboration and positive results from the project. Our program goals are pretty specific, and I'll just go over these briefly in terms of education and access to resources, including expert faculty. We will be trending data on sepsis mortality rates, hospitalizations, and healthcare costs by treating, looking at residents before they become septic. We will be implementing infection prevention strategies in both areas, and then also working to improve understanding between the care settings and transitions in care. Benefits to the participants of the program. This program is free, and it's offering a tremendous array of resources that hopefully can be sustained going forward once the project is over. That's really my goal, and I think Deb's goal, and that of our organizations. We would like to show data trending for the results of the project and continue to monitor for improvements. Our commitment to you is that we will be providing you data reports and help with analysis. You will receive consultation by qualified staff and faculty, the sharing and collaboration around best practices and evidence-based tools and resources, and hopefully developing collaboration that's ongoing and affinity groups. And we will be providing expertise and practical assistance all along the way. We're very excited in that we have a large group of hospitals participating in the program. This is not a complete list. We did have Martinsville Memorial Hospital join the team as well, and we anticipate through some verbal commitments that we have from other providers that we will have probably around 30 hospitals in all participating in the program. And we welcome all of you. Deb is going to talk now about the nursing facilities that have joined our team. Deb?
Sorry, I was on mute. Thank you. Thank you. What I was saying was I wanted to welcome the hospitals. Welcome to all the hospitals that have joined this great collaborative work that we're doing. And this is a list of the nursing homes that so far have signed participation agreements. And just like Wanda was saying with the hospitals, we do have a couple outstanding that we're waiting for them to have the actual signatures on the participation agreements. So we're expecting also somewhere around 30 nursing homes. And we're really trying to make sure that we've recruited smartly so that we have hospitals and nursing homes in the same areas that can do this work together. So, much effort plus teamwork equals success. So we're all about building teams. We really need to have a good team in order to get this work done. There's not one person in a hospital that can do this all by themselves. And these are like the features of successful healthcare organizations. We're going to try to put this all in place. We're using data to track your performance, setting goals. Everyone's going to know those goals. They'll be completely visible. We'll be able to conduct root cause analysis and build your teams so that you can pilot the new ideas and approaches that come from those root cause analysis. And we need leadership involved because the leadership can empower staff. They need to support the staff. We'll learn from others. So right now, we'd really like you all to participate a little bit in this webinar. We're interested in knowing who's on your sepsis team. After this webinar, you're going to be receiving a survey link where you can identify your team members. We want to be able to reach out to the team. We'll have a point of contact, but we also want to keep the teams updated and help you develop your team. So I would really like everybody to just take a second, type into chat what your role is with your sepsis team. And I know that there are those of you out there who have multiple people in your rooms. with you listening to this webinar. So type in everyone's role in the team. And I'm not seeing anybody typing yet. So we'll hang on here for just a second so y'all can get to your chat boxes. The chat box is on the right-hand side. Awesome. We're going to start getting some feedback here. Abstractors, leaders, coordinators, quality directors, sepsis coordinators, VPs of nursing, executive sponsors, QA/QI nurses. Keep it coming. I want everybody to see what a diverse group this is. This is the whole hospital. This takes it's like it takes a village. So this is your team. Thank you. And keep putting that in there. Because only through teamwork can we maintain the game. The interdisciplinary team continues to be a goal. That's what's going to decrease sepsis admissions. And we're going to be helping you. So we're going to talk a little bit about data, but everybody keep calm because data is where we get to the point. These are the outcome measures for both the hospitals and the nursing homes. So it's hospital sepsis mortality rate. That's the deaths in the hospital. As you can see, it's the number of patients with sepsis who expire in the hospital, and that's over all of the patients with sepsis. That data is coming from Part A claims data. We have a pretty good relative improvement rate that we're targeting here, so 10% in the first year and another 10% in the second year. So these are really aggressive goals when we're working together here. Also, the proportion of the hospital admissions from nursing homes that are due to sepsis. So that'll be the number of residents admitted to the hospital due to sepsis over all residents admitted to the hospital. Once again, that data source is Part A claims data, nothing that you all have to collect and submit to us. And there again, we've got some aggressive relative improvement rates going, 5% in the first year and 10% in the second year. The third one is hospitalization rate for residents with a diagnosis of sepsis. So that's residents admitted to a hospital with an active diagnosis of sepsis over residents with an with all active diagnosis of sepsis. So again, Part A claims data. With this one, we're looking for a 4% relative improvement rate in the first year and an 8% relative improvement rate in the second year. I'm going to turn this over for a minute to Wanda to talk to us about the hospital process measures.
So what you see on the screen is an overview of the 3-hour bundle, and we have had accepted from CMS a modification so that rather than submitting a yes/no to the 3-hour bundle, the modification is that each hospital will choose one of the above measures, and this will, we felt, help hospitals have more opportunity for improvement of achieving a yes with their 3-hour bundle. So by selecting the exact measurement from the menu of process measures, you will be able to receive value-added information regarding your performance on that specific individual measure. So hospitals may be collecting different measures, but it will be specific to the work that they have underway and something specific to their organization that they want to improve. The data will be collected monthly once we get hospitals set up, and it will be collected via the survey link sent to the specific contact identified by the hospital.
Okay. Thank you, Wanda. We have a couple of nursing home process measures, I just want to make everybody aware these 3 measures, after we work together for the first year, there's some nursing homes that will be choosing to select one of these projects at the end of year 1, and they'll be working on that in year 2. So documenting admission assessment of infection, timely nursing assessment for changes in resident condition, and timely lab testing for suspected sepsis. So we'll be pulling those out during our work in the first year. I also wanted to talk a little bit about the data that's going to be needed from the nursing homes. So this is also data that you'll be submitting. This is how they've been submitting data with the Maryland project for the last year. It's also a SurveyMonkey link, so it makes it pretty simple for you to submit your data. But all of the data above is submitted monthly, and you'll be reminded we'll be sending you a link. Hospitals will submit the process measures in a little bit different way, but that'll also be another survey tool sent to them. Anybody have any questions about the data? You can type it in the chat box. So this is an awesome website and a really great hospital association that developed this sepsis toolkit. The link is here, and I do want to let everybody know that they'll be getting these. If you didn't already receive the handouts before the webinar, they will be available after the webinar. But it's a great place to go for tools and resources. And it's pretty simple, as you can see there with the screenshots. Once you get into the toolkit, if you're looking for an ED algorithm, for instance, you just click on that and that algorithm comes up. These were all pretty specific to the hospital when they first broke out this toolkit. But they're also revised the tools to be specific to nursing homes. And these are the tools that have been used really successfully in the Maryland work. We'll be making all of this available to you in a toolkit. It'll be modified, and you'll have some instructions on how to use these tools. I also wanted to talk a little bit about the data reports that you're going to be receiving. So as you can see, this is just a sample of the admission data reports that have been sent to the nursing homes. Hospitals will get something similar. We're in the process of developing those reports. But this is ABC Nursing Home, and it's the % of admissions to the hospital with sepsis from ABC Nursing Homes. These are quarterly reports, really great reports to share with your leadership. It shows you where you are in the project. And our nursing homes really appreciate this. We've had great feedback. Here's the mortality data report for ABC Nursing Homes. So just to keep in mind that this is what you'll be receiving from us. We will be giving you data for all of the work that we're doing with you. And I'm going to turn this back over to Wanda.
So, thank you, Deb. I'm going to review what's expected from the participating organizations. And as you can see from the slide, communication with your collaborating hospital and nursing home is key to the project. That relationship building, understanding of care delivery across settings is really one of our main goals. In addition to that, we would like you to participate in learning and action network events. And then data is key. As we state here, you can't improve what you don't measure. And because this work is very new and innovative in terms of going across settings, it's important that you submit the requested data and then review the data with your sepsis support team and utilize the data for ongoing PDSA. If you have any questions regarding your data, throughout, please know that you can reach out to either Deb if you're a nursing facility or to me. if you are a hospital. And Deb and I will be working very closely on the project, and so, we'll be able to help resolve any issues. Next slide. We will, at both care setting environments, have an infection prevention baseline assessment, and for the hospitals, we'll be doing a sepsis baseline assessment. The nursing home assessment is completed via a survey link that will be sent out, and it's based on the Center for Disease Control assessment tool. And for the hospitals, we will be working with the content expert, Kathleen Volman, and she has a sepsis assessment tool for hospitals. And in addition, we will be reviewing the policies and protocols for hospitals around sepsis care and treatment. This timeline just highlights the project. Again, it's a 2-year project, and in Q1 we will be working with hospitals and nursing homes, getting them set up and establishing and reviewing baseline data. And that baseline data will be from your Part A claim. So we will be looking at data in January. We'll have access to your Q3 2016 claims data, and we will have that baseline available, and that's what we will be working from in terms of improvements. In the second quarter of the project, we will work with the facilities to develop customized support plans and also receive feedback if there are any needs that your organization has, work with you to see how we can help with that. And then also begin to identify cross-setting opportunities for peer-to-peer learning, best practices, and improved communication. We will be reviewing specific cases that go from one setting to the other, and again, looking at gaps in care and opportunities for improvement. And then quarters 3 to 8 really will be the case studies, working with the improvement cycle, really refining procedures and tests that have been put in place, and continue to sustain and achieve gains. We want you to keep connected with us. We will have recordings of web conferences, resources on both the HQI website for nursing homes and then also at the VHHA website. I will be creating a separate page for the sepsis project, and I will send that link out to all organizations once it's up and running, and I expect that to be in about 2 weeks' time. And this is just the VHHA website. But again, we will have a specific page for this project. Well, we are at the Q&A slide. So I don't know, Candy, if any questions have come in.
Yes, we've had several questions, and the one I was just getting to answer right now is a question about the data. And they're asking if the readmission mortality data, the reports that we're going to be providing, will include all patients or just Medicare. And the data is Medicare beneficiaries from Part A claims. It does not include all patients. It will be the majority of patients admitted to the hospital from a nursing home, because the majority of the residents in the nursing home are going to have Medicare, and when they get admitted to the hospital, their Part A will kick in. But it does not include all patients. There were a couple of other questions. I have to go back and find them.
Let me just break in here to make sure that everyone gets a chance to ask a question online. Can the operator please let our participants know how they can get in queue to ask their questions? Allie?
Of course.
Thank you.
To ask your question, key, press star then 1 on your touch-tone phone. And if you're using a speakerphone, you may need to pick up the headset first before pressing the numbers. Once again, that is star then 1 on your touch-tone phone to ask your question.
Thank you. So while we're waiting for those in queue, back to you, Candy.
Okay, one of the other questions that was asked was, how difficult is it to sign up for this project? Is it as difficult as the C. diff? And I'm assuming people are referring to having to go in, and get the network, all the stuff they had to do for C. diff. And no, this is not very complicated. Your organization signs the participation agreement, then you're in the project, and then, you need to do the things that both Deb and Wanda discussed with you. Be committed, attend the educational sessions. You will need to submit some data, and you saw what that data is on the SurveyMonkey link, completed infection prevention assessment. But these are things that we can work with you, so it's pretty simple to sign up.
And I'll just interject there, it's Deb. There is no National Healthcare Safety Network to sign up for, so you don't need to get a SAMS card for that. Nothing needs to be notarized. We do understand that there is a process to being able to report that C. diff data for the nursing homes to NHSN, and I will say just a little plug for that, though. Once you do get that process done and you're reporting and you've got everything going for the C. diff work, it's pretty seamless as it goes on. It's very intensive in the beginning, but we don't have any of that for this project.
There was another question about the denominator in the data, and I wasn't sure which data the person was referring to. So I don't know if Wanda or Deb, you can take a stab at that.
Well, who was the person asking, can they get in queue?
I see if I can find my question.
Allie, do we have anybody in queue?
No one has dialed up yet.
Let me go back and find the question.
Well, you're looking for the, okay.
It says, how are you defining your denominator? Is it the same as CMS? From Amy Lucas, and I'm not sure what.
Well, Amy is from a hospital, and when you ask about the denominator for the data, if we're measuring Medicare Part A claims, then the denominator would be all admissions. I'm just going to go to the page in the presentation with the slide on it so I can, just 1 second here.
And if she would like to get in queue to discuss it, it's star 1.
Right.
While you're looking for that, there was another question just asking if they continue to submit the CMS bundle as they have been, and I responded yes, and Wanda, if you want to respond to that as well.
Yeah, that's a correct response. Yes, you will. This is separate from the data that you need to submit to CMS or to any other agency. And, okay. So the sepsis data collection piece, the denominator is, there we go, the number of patients with sepsis. And we will, when we're looking at patients with, number of patients with sepsis who expire in the hospital as the numerator, this is going to be your mortality rate. And then the denominator, number of patients with sepsis, that would be, I think we have to take it from the same pool, so I'm going to say it's just going to be your Part A claims Medicare.
Yes. Yes.
Does that
there was
a question for them?
Yes, because they had asked if it would be Medicaid, Medicare patients, but if we're collecting just Medicare Part A, then the denominator would have to be the same.
Yeah, we'll just get, it's the Medicare claims data.
Right.
there is a question for you, Deb, and it is how many SNFs are going to be part of the project? Is there a cap? And how are you selecting the SNFs to engage?
So there is not a cap. We actually had our recruitment deadline was originally at the end of November. However, we've extended it. Everything that's going on in both hospitals and nursing homes makes it hard to get in and recruit. If you're interested in signing up and you haven't signed up yet, please contact me. My email is in here, but maybe, Candy, you can put that in the chat for them.
Okay.
Because we're happy to sign anyone up. We've tried. Go ahead. And whoever, is there any questions in queue? I'm wondering if any of these people want to discuss it on the phone.
Yes, we do have a question from Renata Sampson. Please go ahead.
Hi, Renata.
Hey, how are you guys doing?
Good, how are you?
Just curious about the data collection and resources required. Are we to collect 100%? Is that a sample population, or?
It's not a sample population, no.
So 100%?
Of the data that's needed, it's 100%, yes.
Oh, boy. Wow. Okay. Thank you.
But would that be
Hospital?
Hospital
Or nursing home?
Hospital. I mean, we have 800 plus beds here.
So this would be for the component of the sepsis bundle.
Correct.
I don't know if I know when you submit it to agencies, you're taking a proportion.
That's correct.
Of those. You're not taking the whole sample.
It's a sample.
Right, it's a sample. I mean, I can follow up with Betsy. I don't know if she's on the line right now to ask her for any detail, but if it's anything other than that, I'll be sure to get back in touch with the hospitals.
Thank you.
And I'll see if there's any variation with that.
Okay.
I just wanted to add a comment regarding the hospitals that did not see participating nursing homes in their area. We will be reaching out, and Deb and her team will be reaching out to skilled facilities or nursing homes in your local area so that you do have that partnership and opportunity for collaboration. And so that is part of our work in these next couple of days. We've had a number of hospitals sign on most recently, and I know they've identified specific nursing homes, and we will be reaching out to them. So more to come on the full array of participants.
So did that answer the question for was it Mary and Joyce, I guess?
Oh.
That we are still recruiting and signing on nursing homes.
And we can use, if a hospital has a contract with the nursing home that they want and wants to do a lead-in, that helps too.
Yes, it does.
Hi, excuse me, this is Betsy Archer from VHHA. I was hearing the conversation. Hey, Deb, I just couldn't get in queue for some reason. I wanted to follow up to Renata's question about 100%. I know because of conversations that I've had with Renata offline that they are collecting that sample for and using it through a vendor. I'd like to kind of re-explore that issue offline with anyone who has that similar concern. So that we can really work through how this program is really in complement to what you're currently doing instead of duplicative. So I didn't want that to discourage anyone who may be thinking that that's going to be a burden. So I'd like to follow up with Renata specifically, and if anyone else has that same concern, please do get into contact with Wanda or myself so we can figure out how to make the program value added.
Thank you, Betsy.
You're welcome. I just couldn't get in queue, so I came over and stole Wanda's phone, so I'm going to give it back to Wanda. Hold on just a second.
Oh, okay. I was wondering what you meant by that. Allie, is there anybody else in queue?
We have no further participants in the audio queue at this time.
I think we've answered all the chat questions unless anyone has another one.
Here, I just put this slide up again with our phone numbers, Wanda's and mine, our email addresses. So please jot this down if you do have questions moving forward. Our next steps, of course, are going to be that we'll be in January. We're planning 2 separate onboarding webinars to get us started with the work. So there'll be one for the hospitals and there'll be one for the nursing homes. That will come out to you pretty quickly. Please be looking for, there's 2 surveys that are going to come out in the next week or so, and we'd like them turned back around, and I know this is asking for a lot when we're looking at the holidays, but in order for us to start planning into January, we'd like to have some of these assessments and your team identified, hopefully by the end of this month. So they're pretty easy. I know the infection prevention baseline assessment for the nursing homes is yes, no, or I don't know. We don't expect you to be taking tons of time to fill out this assessment. It's just to give us a baseline, kind of give us an idea where the gaps are, and hopefully we're going to be identifying, similar gaps within a number of the nursing homes. And then that team, your sepsis team roster, there will be a link for that to fill out who is on your team with their contact information also. So that's moving forward. Here's our contact information. I'd really like to know if there's any other questions on the line. Anybody that got into queue, Allie, it's *1 to get into the queue.
We are standing by for questions. If you're using a speakerphone, remember to pick up the handset first before pressing the numbers that are * and 1 for your question. Thank you.
And any other questions in the chat, Candy, that we can answer right now?
No, we had one question asking, saying they have some SNF networks that they want us to contact, and told them to please let us know who it is that's a participating SNF around the hospital, and we will certainly contact them.
Perfect. Wonderful. This is the kind of collaboration I like to see.
Yes.
Absolutely. Well, I think we're going to be giving you 10 minutes back to your day, which I know I can use, and I'm sure everybody on this line can use. We really look forward to working with you over the next 2 years. This is going to be an awesome project, and it's going to be awesome because we've got some really awesome participants here. Anything else you want to say, Wanda or Candy?
No, I'm just looking forward to working with everyone.
All right. Have a great day.
Thank you.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.